Let's dive right into this explainer. We're tackling a really fascinating core analytical challenge in the drug retail sector today. Think about it for a second. How do we actually, meaningfully, compare massive, sprawling global pharmacy chains with, say, your local regional ones? It's not just some academic exercise, right? Sustainability and operational risk are absolutely huge hot-button topics right now. And with mounting regulatory scrutiny, not to mention demands from ESG investors, just looking at financial revenue doesn't even come close to telling the whole story. We really need a way to understand their physical and operational realities on a level playing field. And that brings us to a crucial question that analysts and investors face literally every single day. How do you evaluate sustainability risks fairly across drug retailers of vastly different sizes? I mean, if one company operates 10 local storefronts and another manages 10,000 globally, how do you translate all of that complex spreadsheet data into a standardized, tangible reality that actually makes sense? We need a tool that cuts through all the noise, completely bypasses the financial bloat, and gives us a true apples-to-apples comparison of operational risk. Okay, let's dive into this. The solution to our sizing problem is something called an activity metric. According to the SASB framework, that's the Sustainability Accounting Standards Board, activity metrics are defined as exactly this: metrics that quantify the scale of specific activities or operations by an entity to normalize data and facilitate comparison. Basically, they're the vital statistics of a business. They give us the raw scale, the denominator, if you will, that allows us to analyze how efficiently and safely a drug retailer is operating, totally regardless of whether they're a neighborhood staple or a massive multinational giant. So here's our roadmap for this explainer. We're taking a physical journey through the drug retail business model. First, why activity metrics matter. Second, the physical retail footprint. Third, tracking prescription volumes. And fourth, the pharmacist workforce. We'll start with the fundamentals, look at the physical footprint from the outside, walk through the doors to track what's being dispensed, and then finally look behind the counter at the humans actually doing the work. Starting off with Section 1, why activity metrics matter as a blueprint for operations. Before we can even begin to measure things like energy consumption, data security risks, or patient health outcomes, we absolutely need a precise blueprint of the operation. We have to deeply understand how these entities operate at scale to accurately assess their impact on the communities they serve. The SASB Drug Retailer Standard lays out 4 exact activity metrics that we'll be dissecting today to benchmark the industry. Categorized from HC-DR-000.A through D, they comprehensively cover pharmacy locations, retail space, prescription volumes, and pharmacist headcount. These 4, honestly, deceptively simple data points are the absolute keys to unlocking a normalized comparative view of literally any pharmacy's sustainability and operational risk profile. Moving on to Section 2, the physical retail footprint, giving us that macro-level business view. Here, we're zooming in on the physical space these companies occupy, kind of starting from a bird's-eye view to understand the sheer geographic and structural mass of these businesses in our neighborhoods. Now, what's really interesting is the contrast between our first 2 metrics. Metric A is simply the number of pharmacy locations, right? The storefront count. But metric B is the total area of retail space, measured in square meters. You might be wondering, why do we need both? Well, think about it. One retailer might have hundreds of tiny pharmacy kiosks tucked inside grocery stores, while another might operate massive standalone megastores. The storefront count tells us about their geographic reach and community access, but the total square meters, that tells us about their physical footprint, and that matters immensely when evaluating environmental impact. Retail pharmacies have intense HVAC needs. They require strict 24/7 cold chain refrigeration to preserve really sensitive items like vaccines, biologics, and insulin. You simply cannot accurately assess a company's energy management or greenhouse gas emissions without knowing the actual spatial reality of what they have to heat, cool, and power every single day. Let's move to Section 3, tracking prescription volumes, to see how this builds our medical scale. We've measured the outside of the stores, so now we're heading straight behind the pharmacy counter to measure operational volume, specifically the actual medicine being handed to patients. And this brilliantly illustrates our third metric, which tracks the total number of prescriptions filled, but with a very specific, distinct carve-out for the percentage of controlled substances. Tracking total prescriptions gives us the absolute volume of medical transactions. That directly correlates to the risk of dispensing errors and the massive data security burden of protecting millions of patient health records. But why carve out the percentage of controlled substances specifically? Well, think about the historical context of the opioid epidemic, right? And those massive DEA fines that have hit major retailers in recent years. The high volume of these highly regulated drugs carries unique, severe compliance risks. We're talking theft, inventory loss, illegal dispensing. These aren't just minor operational hiccups. They can lead to tragic public health consequences and multi-billion-dollar regulatory settlements. By isolating this specific percentage, analysts can immediately pinpoint which retailers carry a distinctly higher operational and legal risk profile based entirely on the specific chemical makeup of the inventory they dispense. Next up is Section 4, the pharmacist workforce, focusing entirely on specialized human capital. We've looked at the buildings, we've looked at the pills, but none of this operates without highly trained personnel, does it? Let's look at the critical professionals actually running these operations. The final piece of our normalization puzzle is metric HCDR000.D, the number of pharmacists. Because normalizing data across massive retail chains isn't just about how much space they take up or the sheer volume of drugs they move, it's intimately tied to the headcount of the specialized professionals legally required to handle, verify, and dispense that medicine while interacting directly with the public. And that word, legally, is absolutely vital here. A pharmacy literally cannot operate its core business if a licensed pharmacist is not on duty. So the crucial point is that a pharmacist isn't just any retail employee. As the official standard outlines, they dispense drugs, provide critical information to patients, and advise physicians on selection, dosage, interactions, and side effects. This metric elevates our understanding from a simple corporate headcount to a strict measure of critical medical expertise. I mean, a massive store filling thousands of prescriptions, but operating with a bare minimum number of pharmacists, that is a giant red flag. In today's industry climate, where pharmacist burnout, labor strikes, and severe staffing shortages are literally front-page news, tracking this exact metric is highly predictive of future operational risks. Overworked staff lead to higher risks of dispensing errors, slower wait times, and lower patient adherence rates, especially when you compare it to a smaller chain prioritizing a robust, well-supported pharmacist workforce. This single data point perfectly contextualizes the human element bearing the weight of the entire operation. And just like that, we've completed our scale journey. We've seen exactly how storefront locations, retail square meters, prescription volumes, and pharmacist headcounts act as the great equalizers when analyzing drug retailers. I want to leave you with this final thought to consider. Think about the pharmacy you visit in your own community. How would you use these 4 activity metrics to normalize their operational data? Do they have a massive physical footprint with suspiciously few pharmacists behind the counter? Or maybe they operate in a small space but manage incredibly high prescription volumes. Applying this analytical framework completely changes how you view the underlying risks and the true sustainability of the businesses operating right in your own neighborhood. Thanks for joining me on this explainer, and keep looking closely at the data.